A heart valve prosthesis is a natural or synthetic valve used to replace a damaged or insufficient cardiac valve. These valves may be porcine, bovine, or they may be artificial mechanical valves. Porcine valves refer to pig valves, and bovine valves refer to cow valves. There are three main types of mechanical valves. Those include the ball and cage, the tilted disc, and the bi-leaflet. This is a picture of a ball and cage mechanical valve. In the picture, you are able to see the restraining cage, the occluder ball, and the suture ring that make up the ball and cage. This is a photo of the tilted disc mechanical valve. In this photo, you are able to see the suture ring, the outlet strut, the flange, the inlet strut, and the occluder disc, all that which make up the tilted disc mechanical valve. Lastly, this is the bi-leaflet mechanical valve. In the photo, you are able to see the suture ring, the two hinges, and the two leaflets, making the bi-leaflet of this bi-leaflet valve. In this cross-sectional photo of the heart, you are able to see the four valves of the heart: the pulmonary valve, the tricuspid valve, the aortic valve, and the mitral valve. The valve that is most commonly replaced with a prosthesis is the mitral valve. The second most commonly replaced valve of the heart is the aortic valve. Post-heart valve surgery, the patient will begin to take a pre-medication regimen prior to any invasive dental treatment. This precaution is taken because the replacement of the heart valve puts the patient at a high risk for developing infective endocarditis. Post-heart valve prosthesis surgery, there is a minimum of a 3-month delay for all elective dental procedures. This can greatly affect the patient's oral health, especially if they're on a short recall system and if they're not in the habit of taking very good care of their oral cavity. There are also medications that the patient will be prescribed post-surgery that could cause adverse reactions such as xerostomia. Also, if good oral hygiene is not maintained, the oral health may play a role in heart health and the overall health of the patient. Periodontitis can possibly be detrimental and cause damage to the heart, resulting in heart disease. And if substantial oral hygiene is not maintained, the patient could be placing themselves at a higher risk for infective endocarditis. I would now like to introduce you to my patient.
I'm Barbara Wawa.
Everyone meet Baba. Baba Wawa is an 80-year-old female, periocase type 2 and difficulty B. 6 months ago, Miss Wawa had heart valve prosthesis surgery to replace the damaged mitral valve in her heart. Here is a copy of Miss Wawa's most recent FMX. In this FMX, you will notice there is some bone loss. Because of Miss Wawa's age, natural bone loss is expected. However, the excessiveness of the bone loss and the depths of the periodontal pockets are caused by much more than just Miss Wawa's age. These clues hint at a more severe problem: periodontitis. Here is one of Miss Wawa's intraoral photos. In this photo, you are able to see the effects that the periodontal disease has had on her dentition and her gingiva. Miss Wawa's medications include Coumadin, which is an anticoagulant that was prescribed to her after her valve replacement surgery. It has also caused her to have taste alterations. She is also experiencing some xerostomia problems from the lisinopril prescribed to her for hypertension and also from the Lexapro, which she uses for depression. Miss Wawa is also taking Zyrtec, which she uses for her seasonal allergies, and she has also been prescribed amoxicillin. This is her pre-medication regimen, which she will take 2 grams of 1 hour prior to any dental treatment. And breaking news, take control. To help combat the periodontitis, Miss Wawa needs to greatly improve her oral hygiene habits. A consistent brushing and flossing schedule must be implemented. It should also be recommended that Miss Wawa begin to use a non-alcoholic antimicrobial mouth rinse. I would recommend to Miss Wawa an electronic toothbrush such as a Sonicare or an Oral-B. Because of her age, she might have difficulty gripping a smaller handle. This type of toothbrush has a bigger handle, making it easier for her to grasp. This could aid Miss Wawa in the removal of plaque biofilm. I would also recommend the flosser picks or the reach flossers with the handle as adaptive devices to Miss Wawa. These 2 devices could aid Miss Wawa with the act of flossing if she were to find it troublesome to attempt to use regular floss. Here is an example of the non-alcoholic antimicrobial mouth rinse that I would recommend to Miss Wawa. This mouth rinse also contains fluoride that would protect Miss Wawa from carious lesions that could be caused by her xerostomia. Our role as a hygienist is to communicate to your patient the importance of good oral hygiene. As in Miss Wawa's case, it was very important for me to discuss how to combat her periodontitis and improve upon her oral health. And lastly, above all, always make sure that your patient understands what you are trying to communicate to them.